After a stroke, your face doesn't always match on both sides. Maybe one eye drops, maybe your smile pulls to one side, or maybe you drool when you drink. I know it feels frustrating and sometimes embarrassing, but here's the truth. Your face can improve, your symmetry can even get better, and your brain can relearn how to move the weak side again. Today, I'm going to show you 5 simple exercises that I teach my stroke patients to help lift their eye, even smile better, and control their drooling when they're drinking, and even keeping food in their mouth. And yes, these exercises also help people recovering from Bell's palsy. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. As I have mentioned, we're going to gently retrain the weaker side of your face so you can smile, speak, and express yourself with even more confidence again. So here's the simple truth. Your face muscles don't die after stroke. You might think it is not functioning, but it is still there. Your brain just has trouble sending signals, clear message to that area. These exercises help wake up the weak side, calm down the tight areas or the spastic areas, and get both sides working together again. Now, once your brain remembers the pattern, the drooling starts to improve, and your face starts to become symmetrical, and you're able to talk much better and have more expressive facial expressions. So if you're ready, let's get started. Alright, let's start with a cheek lift and tap assist. So this is something easy, the cheek lift. This helps your smile look more even. So here's what you want to do. Try to lift your cheek on the weak side. So for example, your weak side is your left side. Lift it up, and using the 2 fingers, just try to tap that area. Hold it for about 2 to 3 seconds after, and then relax for a few minutes. Then repeat this 8 to 10 times. Again, lift up the weak side. You can try to smile, and then tap for about 30 seconds, and then hold the lifting of the cheek, and then relax. Repeat 8 to 10 times. So the tapping wakes up the muscle and helps the brain send a stronger signal. Next exercise is the big E with a head turning. So this is how you do it. Make a big E face. So try to grin as big as possible. Feel your cheeks lift, and then slowly turn your head left and then to the right while holding that E face. Relax, and then repeat that a few more times. This teaches your face to stay even while you move, which is important for real-life symmetry, like you are talking to your friends, to your family members, or even going out to do your grocery shopping. Third exercise is the cheek puff and corner lift. This will improve your smile symmetry. We are going to work on your smile again, especially if one pulls to one side. One side is drooping. So here's what you're going to do. Puff your cheeks with air. Do not let the air out from your lips. Hold it for about 3 seconds. Try to keep that air from leaking out on the weak side. Make sure that both sides are symmetrical. Now lift both sides into a smile. Even tiny movement counts. Your brain is now reconnecting. Alright, the fourth exercise is the lip press while holding a straw, a pen, or even a spoon. So if you drool or lose saliva or you spit, this means your lips aren't sealing well. They are weak. The muscles of your lips are weak. So here's how you're going to strengthen your mouth and lips muscles. You gently press your lips together and then hold it for about 5 seconds. As I have mentioned, you can use a straw, pen, or a spoon and then hold that in your mouth with your lips sealed. Try to remember to hold it using only your lips, not with your teeth. This will strengthen the lips muscle so that your spit or your saliva or your food stays inside. Alright, for the final exercise, we're going to do the eye lift plus slow blink assist. For most of my patients, this is the most challenging part, which is the eye's symmetry. So here's how you're going to do it. You're going to lift both eyebrows. You're going to use your fingers if you can't do that on your own. Now try to blink slowly. You can help the weak parts like your eyelids or your eyebrow muscles with your fingers. Repeat these exercises 10 to 20 times, 3 sets. This exercise improves your eyelid control, and one eye does not stay open when you're sleeping, and you have more confidence getting out from your house and interacting with other people. Right, so if you're still here, type the word smiling in the comment section, because only when you smile and stay positive can make it this far, and you are one of them. So I have had patients who stopped smiling and hid from cameras or avoided talking because of face drooping, and not going to restaurants because they are constantly drooling, losing food in their mouth. But once we did these exercises daily, their eyes lifted better, their smile became bigger and more even, and their confidence became more apparent. They're able to interact better with their family and friends. Yes, your face can improve, your brain just needs practice. So remember, you don't need a perfect face to show your joy or your happiness or your confidence, but you can retrain the weaker side. You can lift the drooping, and most importantly, you can smile again with pride. So all I'm asking now is to share this with someone recovering from a stroke or Bell's palsy who needs simple and hopeful and effective exercise to improve their face symmetry. And just a reminder, consistency is the key and never give up. Until next time, paalam! Zoom!